this very special show, and I'm your host, Ruchira Sharma. Did you know that more than 1.3 million new patients are diagnosed with cancer every year, and over 850,000 patients die of the disease annually in our own country? What's more, cancer contributes to almost 8% of adult deaths in India alone. And researchers and doctors have highlighted that cancer screening in India has taken a backseat, especially due to the ongoing pandemic. And that is why we have seen a rise in cancer cases as a direct consequence of that. So, for something that affects us all so deeply, there is very little conversation about it. And that is something that the doctors at Manipal hospitals are trying to address. So, with the Can Conquer Cancer Initiative, Network 18 and Manipal hospitals have joined forces to raise awareness about this deadly disease. Cancer, the most common types of cancer, how can they be prevented, its treatment, and its cures. So, as a part of this initiative, we are in conversation with Dr. Rohit Kumar C, consultant surgical oncology, and Dr. Nitin Murthy, medical oncologist and hemato-oncologist at Manipal Hospital, to gain more clarity about this deadly disease, often known as the silent killer. So, thank you, doctors, for joining us today. Thank you for being here with us.
It's great to be here, and the initiative is we always believe that knowledge is power. And this month, especially where we celebrate World Cancer Day, I think it's important for all of us that in these times of the big C of COVID, it's important not to forget about the other big C, cancer.
Great. Thank you so much for sharing that. So, Dr. Rohit, let's begin with you. Could you
Sure.
help us understand, in simple layman terms, what cancer really is and why has it become the second leading cause of death in our country?
Yes, as Dr. Nitin just now told, and we have been talking about it since quite a time now, that everybody is more in terms of thinking more in terms of the common word C in terms of COVID. And
Mhm.
the word cancer has been neglected a lot. The mortality rate when we speak in COVID is just around 4%. But if we see in our own Indian data of cancers, the mortality rate is nearly more than 45 to 50%. That is, every second person that has been diagnosed of cancer is been dying of it. So, what exactly is cancer? Cancer is nothing but a abnormal, uncontrolled growth of cell.
Mm.
So, as a human being, the basic division of our life is a cell. A cell undergoes controlled division. During this process, there can be some changes which usually the cell is able to taken care of. But at times, these changes accumulate in the cell, leading them to go haywire. They start to grow abnormally
All
and
right.
the growth becomes uncontrolled. With the education that we are providing and the screening techniques that has been slowly started to adopt in society, we are recently seeing a gradual trend towards early diagnosis. So the most common cause I would tell in India as such is the advanced stage at which they are diagnosed.
All right. What are the kind of symptoms that, according to you, we need to be alert for and look out for? Mm.
Usually, the earlier stages of cancer do not show many prominent symptoms. The general symptoms are in terms of a very reduced appetite, not feeling a well-being of yourself. You don't
All right.
feel like you're normal. You have a very vague decreased appetite, don't feel like eating food. You start to
Mhm.
lose weight and unexplained symptoms. Then
Mm.
please don't keep on treating for yourself. Approach your doctors and get evaluated. This is a very important thing for everyone to take away from here.
So that's very helpful to know. And now coming to you, Dr. Nitin, cancer is infamously known as the silent killer. And looking at the statistics, one can see why it is such a big problem. So, what would you say is causing the increase in the number of cancer cases? Is it a lifestyle or is it a diet or something else?
Um, One of the most common myths that we encounter with our patients when we first break the diagnosis of cancer is that there's no one in my family who has had a history of cancer. Why did I get cancer? That's the most common myth, that cancer is hereditary. So, to sum up, cancer is a multifactorial disease. About
Mm.
one third is caused by tobacco related, alcohol increases the risk of cancer, and lifestyle changes. Obesity, lack of physical activity, diet, and sleep. All these are risk factors for cancer.
So we spoke about the problem, Dr. Nitin. Let's talk about the solutions and treatments, really. So if one does get cancer, how should one proceed? What are the treatments options that are available to patients? And is surgery the only way forward?
Once we diagnose cancer, cancer can definitely be cured, especially if it is in the early stages.
All
A
right.
good successful treatment of cancer,
Mm-hmm.
most cancers involve incorporation of what we know as a multidisciplinary team approach. That is a combination of surgical methods, chemotherapy, and radiation therapy when it is required. In most cancers, after the surgery is done, we give chemotherapy or radiation therapy based on the stage and the biology of the disease to reduce the risk of cancer coming back. At times, we give chemotherapy before the surgery to sort of shrink the tumor so that more of organ preservation surgery can be done and the outcomes are also better.
So, Dr. Rohit, I've also heard of HIPEC and PIPEC. So, could you tell us a little bit more about them and explain what really they entail?
HIPEC or PIPEC. That is, HIPEC is hyperthermic intraperitoneal chemotherapy. PIPEC is pressurized intraperitoneal aerosol chemotherapy.
All
So,
right.
this technological advancements for the treatment of cancer is mainly used for treatment of advanced cancers. So, PIPEC is able to give that good quality of life, that care that is important for the patients. So, from palliation to comfort, from cure to care, and from no, that is no hopes to hope, is what PIPEC is providing for patients diagnosed with advanced peritoneal carcinomatosis.
Could you tell us a little bit about immunotherapy and how is it really different from targeted therapy?
So, what exactly is immunotherapy? Now, usually our body's immune system is able to recognize abnormal cells or cells which are not functioning the way they are, and it can eliminate them. But sometimes what happens is that these abnormal cells start expressing certain proteins on their receptors, which make them evade our immune system, meaning to say our immune system is not able to effectively fight these abnormal cells or cancer cells. And targeted therapy or personalized medicine has revolutionized stage 4 lung cancer, particularly in non smokers.
All right. Thank you so much for sharing all those insights. This was truly enlightening. Thank you, Dr. Rohit and Dr. Nitin, for your valuable time today and sharing all these insights with our audience. Thank you so much for joining in.
Thank you for having us. Thank you so
Thank you.
much.